Hi and welcome to Everything Digital Health. I'm Marcus Bohr. I'm a GP and a software developer and clinical informatician.
And I'm Nadia Kuftinoff, and currently I am a program lead for a digital transformation team at an integrated care board.
We have had a few chats recently ourselves about digital transformation, and we thought that there were some things that we would like to discuss and record and bring to a proper kind of forum, as it were. So we're going to talk about digital transformation today. Part of it is going to be gently deconstructing digital transformation and trying to see if there's anything we can draw out from that. What do we mean by it? Is anyone really doing it? And so all of this is intended to be in the spirit of learning. We're not trying to destroy the art of digital transformation, but I think if we can improve on it and make something that fits the NHS better, then I think we've succeeded. So to that end, the idea is to sort of play around with what we mean by digital transformation. So one thing we wanted to talk about was, what people use the word digital transformation a lot. We have teams called digital transformation teams. What does anyone mean by that?
I think it's very well intentioned. I'm part of a digital transformation team, and the purpose of that is to dedicate a selection of people to really well-meaning digital projects that are developing or improving something. So at an integrated care board, my remit in my part of the team is all around digital transformation of primary care. And that's a big ask. And I think digital transformation, labeling it that, is kind of setting people up for this monumentous task of completely changing everything with digital technology into something bigger and better than it is currently.
Mm-hmm.
So digital transformation is admitting that there are things that can be done better, which is a great first step. And then branding it as digital will save everything, and everything is getting changed, and it's all going to be because of something digital that's going to be implemented, whether you like it or not, maybe.
Yeah, it's a pretty big ask, I think. And the NHS is in need of digital transformation, in inverted commas, but I'm not sure if we're clear enough on what we actually mean, or tight enough even in how we sort of approach it, because we've got different areas of the NHS that would be transformed in totally different ways. So like patient-facing services, the emphasis there has to be on inclusion and accessibility and making sure that it's understandable to every single person and that it doesn't exclude them because they don't have devices. And there's a whole load of things that you're doing at that end. And then if we talk about clinical software, that also needs to be digitally transformed, but it needs to be done in a completely different way. And my digital transformation favorite story is always imagine a world in which you have an outpatient appointment, it gets rescheduled and maybe moved back by a day, or even, let's say, moved forward by a month. Who knows? But the point being that when that change of the appointment happens, your patient transport service ambulance gets automatically rebooked because they know that, firstly, you're eligible for a PTS ambulance and you need one. And secondly, that there was already one booked and that booking needs to be amended and brought forward. Now, at the moment, that workflow is imaginable in a fantasy sense, but it is not imaginable happening. No one's going to be able to build that because we haven't put in the infrastructure. That to me would be a digital transformation story, but I think we're a long way from that in the NHS. Mm-hmm. And we also have these two ends of it, whether we're talking about patient-facing services or clinical-facing services, or the example I gave, which is like a bit of both. Mm-hmm. It's sort of in the middle. Let's see if we can draw out a bit more of what actually, what is transformation. Mm-hmm. So, that would be an example. Have you got any other examples of things that, or, that you could imagine that you would like to see?
I think there's a lot of making things better examples that exist that haven't necessarily transformed how a huge thing works for, at a national scale or even at a regional scale. But there's been a lot of improvements made by something either incorporating a digital technology or using digital technologies in a different way than are being used currently. And that can be a lot to do with new things that are introduced kind of organically, like Microsoft Teams, or it can be something that has fulfilled a need that was there already. So I've seen services transformed by digitizing their administrative processes, which has saved people a lot more time to be able to do other things. I've seen people introduce software and platforms which makes it easier for patient care to be enabled in a slightly different way. So maybe that might be the clinician who's seeing them, maybe that's the reporting that takes place behind the scenes. Like there's all kinds of things that sort of interlink together, that it might not be, okay, well, we've transformed how we're treating patients with type 2 diabetes, but there's been some kind of knock-on effect with how a digital innovation has improved a service overall that may have also made efficiencies in another part of the service. Like it's really difficult to say, here's one thing that's happened and everything is better because of it. Although you can use national examples and things like the NHS app, that's been very transformative. Things like online consultations have been very transformative. You can narrow it down to particular innovations. So when the pandemic was kicking off and AccuRx kind of stepped up into that arena, that was transformative because that revolutionized the way that a lot of practices not were only using digital technologies to deliver patient care, but also their attitudes towards digital technologies and enabling a different way of working or better ways of working through the technologies that were available to them. So there's loads of examples that I could think of off the top of my head, but the crux of it is that it's making things better. There's been a development and improvement, and there are cases of huge transformations at scale happening. But what's also important is the little things,
the smaller improvements.
Yeah.
Okay, so like that in a way allows us to sort of challenge the phrase transformation. When everything is a digital transformation, then a small improvement sounds like it's not good enough. I think when you're calling teams, we have a transformation directorate at the moment of NHS England, they thought that transformation was enough to call it, and to call all their essentially digital stuff the transformation directorate. And I'd like to peel that away a bit and maybe challenge it and say, I don't think they should call things transformation if improvement is what they mean. Because transformation does imply some kind of absolute revolution in the way that things are done. And sometimes that isn't what we need. I think transformation implies that everything that's been done before is wrong or somehow backward. And I don't think that's very helpful. And so I would like to see transformation reserved for the things that truly are transformative and not bandied about as just like, our digital team is called the digital transformation team. Why? Because it sounds good. I think there's far too much of that in the NHS anyway. So I think for me, I would like to, my room 101, I'd put the transformation word in. That's what that would be my case for saying it isn't always transformation. I don't know. What do you think about that suggestion?
I would agree, because being in a transformation team, some of the work I'm working on, you could call it transformative, but it's better placed to say that it's a development and improvement of pre-existing services. Like there's no money to get a brand spanking new thing that's going to change everything for everyone. It is a lot about optimizing the things that we already have in place and using them to their fullest potential to the best of our ability, which you could describe as transformative, or you could describe it as just developing and improving what we've got already. We've already got those things, those bits that those technologies are addressing are already in place. So the transformation, I guess, has already happened, but us using them in a better way or a different way, that's the thing that needs to happen next.
Optimizing the thing you've got, which is I mean, in the real world of real things everywhere, very few things get improved by total transformation. Everything we do is more about just little incremental improvements. I mean, if you decide to improve your, I don't know, running fitness or something like that, and after a year, someone might look at you and go, "Wow, your running times are transformed because look how fast you can run 5K or something." But that wasn't transformation. It didn't happen overnight. It happened through just running regularly. Some, as an example, but those are the things that where incremental improvement is ignored in order to focus on transformation, because it's, everything is awesome. It's that kind of feel.
I think you also have to be careful with the word transformation because of the impact that can have. I think there's been a lot of digital transformation that's happened that has been really amazing, especially during the pandemic. But it can also, I think, make people roll their eyes a little bit, like, oh, here come the digital people with another transformation project, and they're going to disrupt, and not in a positive way, and they're kind of not really getting what we're saying, and it's just going to end up in a thing that gets shelved. And to that end, you could argue the same with the word digital as well.
Yeah. Well, if I'm a GP, and if someone came in and said, we're going to digitally transform your EPR, your clinical system that you use to record the patient notes in, I'd be quite wary of that, because that it's not, even if it was 10 times better, the thing that you give me, there's still staff training to do. There's still all the GPs having to get used to it, and all the practice nurses and the healthcare assistants and the reception staff. And it might have different patient-facing pages. So there's a huge amount of business change that goes with getting a brand new system, even if it is brilliant. So transformation puts the fear in, I think. I also want to come back to the thing you said about some of the things that we don't have the money for, or where the existing system is so embedded that we can't transform it. So a lot of the existing digital systems that we've got across the NHS are not really ripe for transformation, even if we wanted to, because there's not the will, not the funding, or not the technical capability to just rip them out and start afresh with something brand new. And so we don't do ourselves any favors by talking about digital transformation as though that's the only acceptable outcome.
I think you're right. And I think also, given all the uncertainty around things that are happening with integrated care boards and NHS England at the moment, I know that there's a huge appetite for innovation and transformation, and people addressing those things in new ways from what we're doing currently. But we can't be certain of what the landscape is going to look like in the next 6 months, 2 years, as things change as well. So that's quite a prohibiting factor on what we can set our sights towards. And we could have a whole other separate conversation about building things in-house and open source and being really transformative and really innovative. But at the moment, it's like we're just kind of hanging on by the skin of our teeth, just trying to get operational things, to stand up and keep the lights on.
And it feels as though like small incremental improvements in any organization would be likely to remain, even if there's a big change in the organizational structure or the organization disappears and then a new one comes. Small changes can kind of be kept. They're your saved game kind of thing. But if you were midway through some kind of major transformation program and you get a restructure, it's more than likely that you'll lose your funding stream, and you'll lose key people who are driving it, or you'll lose the SRO, or lose the sponsors, as it were, the people who think it's a good idea, and you end up having to sort of back away from it and sort of or just falter. And so you get nothing instead of digital transformation, whereas little incremental improvements you get to keep. Can we have a talk about the word digital in digital transformation? Because is that helpful?
No. I think when you work in digital health, you love to see the word digital because it means, ooh, this is an exciting thing, that
validation.
Like I can get involved with this, or this is going to be something like really great, and we've got an opportunity to be involved and be a key stakeholder and have loads of stakeholder and user engagement and all the rest of it. And it makes me happy to hear somebody say, well, okay, sometimes it makes me happy to hear somebody say this is a digital thing, because I can swoop in and be like, yes, I've got the expertise for this. This sounds really exciting. I want to be a part of it. And then other times it fills me with dread because it's a digital product, but it might not necessarily fall under my remit. And then I get stuck in this, I want to help, but strictly speaking, I'm not supposed to be helping, and when is digital not digital, and explaining that to people it makes me look unhelpful and unwilling. And sometimes actually what I want is to empower other people to take ownership for digital things, because it doesn't always have to be me that gets involved. But moving back to your point, sorry, moving back to your point about the word digital, I do think I once worked with a colleague who described digital transformation as clinical transformation, and that really had an impact on me. And then taking that further into the questioning of the word transformation, is it transformation, or should we badge it primarily as development or improvement? And when it stops being clinical work per se, can we stop calling it non-clinical work? Because we do tend to have these two camps in digital health, where something's either clinical or non-clinical, but maybe changing the language around non-clinical and instead thinking of things as, delivery or operational or something like that. So there's something improvement or development, but it doesn't necessarily need to be clinical, but there are other words for it.
There's always a slight weakening of a concept when you refer to it as to what it's not.
Yes.
So this is the non-clinical. Well, it's all valid stuff, but it sounds a bit as though we don't favour that because it's like non-clinical,
right? It's like that. The story of was it Obama who went on a tour of NASA, and he was speaking to a janitor and asked, "What do you do here?" And the janitor said, "I'm putting a man on the moon." Like, he didn't say, "Oh, I'm not an astronaut," and I'm not an engineer, but he saw himself as part of the overall mission statement of the organization and the project that he was supporting and being a part of. And I myself have, people have said like, "Oh, what do you do?" And in particular contexts, I will say, "Oh, I'm not clinical," just to clarify, "Oh, I'm not a clinician." I'm not a clinician, but it doesn't mean that I don't have value and I shouldn't be proud of what I bring to the table. Absolutely. And we shouldn't be saying, I feel that the distinguishing projects as a clinical development or a non-clinical development, non-clinical encompasses so many different things, and those things are still very, very important and matter to clinicians and non-clinicians alike. If it's a clinical improvement project, fantastic. If it's an operational improvement project, that's great too, because that probably affects clinical work somewhere down the line. So the words digital transformation are great and really exciting, and I love to see them, but I think it also narrows the scope of who's going to be interested and excited.
Very much that, because I'm heavily involved in digital work now, but if I cast my mind back to myself in 2005, when I'd not done had no involvement at all in digital, and I was an anaesthetist working in Liverpool, and all the people I knew were also working around that area in ICU and A&E and that sort of thing. And if you said to them, "Would you like to get involved in a digital transformation project?" they would say, "Oh, well, I don't know anything about digital, and I'm not sure I'm the kind of firebrand who's going to drive transformation." And I don't think they would know what it was, and they would certainly feel it wasn't for them. Mm-hmm. So we may be excluding a lot of clinicians who would get involved, but don't feel it's for them because of how we're branding it. So it's become like owned by digital transformation teams, which admittedly might have clinicians in, but they might not have many. And we're sort of making it feel like all this improvement and all the resources for improving things are not available to your kind of ground floor staff who are just working every day at the coalface kind of thing.
We're also pigeonholing ourselves to a certain extent as well. So a lot of people in the digital health profession are qualified project managers. They have experience in agile project management. And those are transferable skills that can be used in lots of different ways. Innovation is a product, a process, or a service, right? So it's not always going to be a product, and it's not always going to be a digital product necessarily. And I think it's great to have subject matter experts in digital technologies. That is fantastic. But there are also opportunities for that kind of skills matrix working that everybody's so hot on at the moment because we're so under-resourced. We have to look at the capabilities within our teams, and we've got so many talented people who are fantastic at, product management and change management and business management and all of that kind of stuff.
Yeah.
And just saying this is the digital team and they only do deal in digital, but not that kind of digital because you paid for that website, and not that kind of digital because, well, we don't hold the contract for that, and not that kind of digital. We're missing opportunities to.
It's all been split up too much, hasn't it?
Like we should be empowered to help with all the digital things that we possibly can, where it's appropriate, but also, it's an opportunity to get involved and use our skills in different ways. And it might not necessarily be, well, we've taken somebody from the digital team to go and work on a non-digital project. Like, that's kind of taking a resource that doesn't necessarily have the capacity to be taken away from that team, but recognizing that sometimes the answer isn't always digital. So
yeah,
we have to allow for that as well.
It feels as though we keep coming back to the idea that maybe, clinical improvement is a better term.
Mm-hmm.
It's going to achieve the same ends. There's nothing to stop clinical improvement being transformative if it just happens to go that way. I mean, you raised a really good example before about AccuRx, which was already an existing product at the start of the pandemic, but was able to expand very rapidly because there was an emergency and there was a good opportunity, and it particularly suited the needs at the time. But before the transformation, there was just gradual improvement.
Mm-hmm.
They'd come up with a product that added a feature. For those that don't know about AccuRx, it's an add-on for GP core systems. So a system like TPP System 1 or EMIS Web or something like that, that's the core GP system, those have been around for decades, and they're used for like recording the text narrative of the GP record. But then AccuRx enabled you to send text messages to the patients, but also get replies, and for a lot of that transaction to be recorded in the notes so that you'd be able to see the discussion that had been had with the patient, and you could very conveniently ask people without having to phone them, and they could reply when was convenient for them, and you could then action those incoming requests and things. So that was incremental improvement that turned into transformation because of a good opportunity. Mm-hmm. And when we start from transformation, it sounds like we're saying we want to be a rock star without learning an instrument. Mm-hmm.
Yes. And I think a lot of emphasis, well, there's two things to your point. Like, I really enjoy an environment where you are working closely with the supplier for their development and improvement for their product as well. And that's where I really see a lot of the value. Having worked at an academic health science network, health innovation network, I saw a lot of that, where you were getting SMEs who wanted to develop their product better by putting it in a real world environment, and then have it evaluated and get user insights and get the feedback there and then, so that they could make their product better and work well for the audience that it was intended for. So that kind of working is fantastic as well. And you do need people with digital expertise to come in and help act as the go-between between the people using the product and the suppliers themselves. That's really useful. And then looking as well at the development and improvement element, where you have a product that everyone is aware that there can be some improvement on both ends. So we need something to improve this scenario, and we'd like something to make it better or faster or more convenient or something like that. I worked on an evaluation once where I was asked to evaluate a product that had been put into a service in a mental health trust. And the conclusion of the evaluation wasn't necessarily that this is the best product in the world, but the attitudes of the workforce was what was making a holistic improvement overall. And it wasn't just because of that product, but there were other digital technologies that were introduced before the implementation of that particular product, or just after, or the attitudes had completely changed to adopting digital to help with things. And it was because a team had come together and worked really hard to change the way that they were doing things to see a positive outcome. And they kept doing it. And once they had seen a success with one thing, they were more open to adopting new technologies to try things out. And that can take a long time, because there's been a lot of tech failures in the NHS and in different services and at different scales as well. So once bitten, it's a bit like, well, I don't want to try something else new because that didn't work last time, or it's going to cost a bomb, or the supplier only has a one-size-fits-all model.
People definitely get wary of it, don't they?
They do, and I think you just get digital transformation fatigue. Whereas if you say, well, let's work on improving a process or something, then it's you have to think of things in a different way.
Yeah, totally. Because I think if you were to ask everybody that's involved in a particular part of the service if they would like to become involved in an improvement program, and then ask them what they think is the thing to do next to improve that program, and the answer was not a digital thing, that should be fine. It should be okay for the next step, or the next one, not to be anything to do with digital. At some point, you might have digital as part of your solution, but it comes back to the whole, this is clinical improvement, not digital transformation. If you presuppose that the solution to everything is going to be a digital thing, then you'll be building the wrong thing all the time.
I think that it lends itself to the question, like, should we just have digital teams with digital specialists in them? And for some digital things, that is the requirement, like particularly if they're very technical roles, or if they're just looking at one aspect of digital technologies that requires a very, very specialist skill set. That's great. When it comes to the transformation teams that exist at the moment, if there are any left, I know that it's kind of a depleting workforce at the moment, so digital transformation teams I don't think are what they once were, even 5 to 8 years ago. But I think there's something to be said about redefining what a digital team consists of. And I've worked in a big digital directorate before where there were lots of different aspects of digital health occurring all at once. And there were user researchers, and I would go out onto the wards and I would spend time with people who were inpatients and people who were in the learning disabilities care homes or the older people care homes. And my job wasn't necessarily to take care of all of the techie things that were happening, but I would certainly, if someone was saying, the computer isn't working or this isn't working, I knew that there was a team that could go and deal with that. But I was there to holistically understand what the needs were. And a lot of people will say like, oh yeah, we need to do user research and things like that. And there isn't the time taken to go and spend time with people because sometimes there just isn't the money or the resource to let a project happen, or there's only enough time to do the projects that we've been told that we have to do, or resource has to be spent on national initiatives which are important and in some cases are mandated, but we're really stuck when it comes to allowing ourselves the time and space to find projects that could be low-hanging fruit and quick wins. It might just be a case of spending time with people to help them. And I could talk at length about, the digital support that we give people. I'm sure everybody who works in digital health is like that person in their family or their household where like they're the ones who fix the laptops or, the TVs on the blink or something.
NHS app login.
Yeah, exactly. Yeah. Things like that. And like that kind of holistic skill set is vital as well. And it's really critical to supporting, and I know it gets more into BAU and maybe that should be like a help desk thing, but if you're with someone and they ask you for help and you know that you can fix it or there's somebody in your team who can assist or something like that, that's a little transformation. That is showing someone that the digital team, even though it's not their remit or whatever, they will try and help you with the expectation that perhaps you can learn and do it yourself next time, but sometimes it takes a while for people to remember the things that you did to be able to do it themselves. But that's also transformation. That's showing like you can do this too.
Well, I like that a lot. The idea that, see, when a national level project about digital transformation is announced, it implies there's always a kind of suggestion that it will be fired out of a cannon and everybody will receive it simultaneously and they'll all know how to use it. And I like the idea that actually digital transformation happens on the ground. It's much more slow paced and it involves like education and training and gradually bringing everybody along, as opposed to creating almost like a divide within your workforce, the people who can use that system and the people who haven't yet learned, kind of thing. I'd like to go back to a bit about like what is digital transformation when it's done really well. Just to sort of, I suppose, give an example that we can then contrast with the NHS and the situation in the NHS, because this is a great example of an actually transformative situation. And it was back in the days of gov.uk and the government digital service team, the GDS team, led by some really inspirational leaders who are still around in the form of public.digital. And they had ministerial top cover, and they were given the remit to make some really great improvements. They didn't take away anything, but they added an entirely new digital doorway for dealing with the government through gov.uk. And so they got rid of what at the time was like 17,000 different governmental websites and gradually drew them all under the flag of gov.uk. So everything on there looks kind of similar. It's got the same font. It's using big text, and it tends to avoid complicated words, and it makes things broken down into like stepwise transactions. And one of the great things that they did there was just renewing your car tax, which, like, I'm old enough to remember having to go to the post office with my insurance documents and I think the driving license and my registration documents and a check for however many £100 it was. And you had to have all of those things and take them all physically to the post office, queue up. Then it would take a while for them to process it, and they would put a stamp on it and validate it. And they would sell you a paper car tax disc, which you'd put in the window of your car. And then in a very short space of time, that was transformed so that I get an email to say I have to renew my tax. And that includes a code that I put into a website, and they have all that information. So that process is now just less than a 5-minute job, and it's instantaneously done. Don't even need a tax disc because now they know that registration has got tax on it. So a fantastic story of making what was a chore to be procrastinated into something that you can just do at the start of your coffee break or something and have it done and feel like, great, that's out of the way. And where are the opportunities for that in the NHS, or are there any opportunities? Is it possible even?
I want to think that it is. I want to think that we're not done yet. Because if we're done,
we can't be done. I mean, there's always improvement to be had, and we've said this is clinical improvement, not digital transformation.
Yeah.
What's to play for, out there? I suppose I'll put you on a spot to think of an example, really, but there are so many things that could be drastically improved.
I think so. I think your example is fantastic. Like the whole being able to tax your car online in like 5 minutes thing is incredible. Like you can type into Google when bin and get taken to the website that tells you when to take your bins out. You genuinely can. That is incredible, right? If you had the capability to Google something and be taken to the NHS service that you need straight away, I think we're seeing more of that. And that's a lot to do with, web presence and optimization. And then it leads into the accessibility of the website and the uniformity and the NHS brand and things like that. So that is really lovely to see. And we're seeing more and more adoption of NHS flavoured websites for general practices. And I hate to use that as an example and pick on some of the awful GP websites that have been out there, but they are developing and improving. And I think suppliers, you've got the design packs and stuff for that now, and the design principles, and that's really, really important. So it's nice to see that things like that are improving. Again, it's just like, sometimes it's just the little things. And if you talk to the general public, like when I try and explain my job to people, and I say I work in digital technologies in primary care, if I'm feeling like that will kind of encompass what I'm trying to say at the time, I get immediate feedback about how difficult it is to get access to their GP. And that's where things like improving access and transforming primary care initiatives come into play. And there's so much more we can do, because people talk a lot about how we're not even getting the basics right. And that is true. And we might look back on some of the things that we're doing now in terms of online consultation and websites and telephony and be like, oh yeah, I can see how things have progressed and changed over time, and things were actually rudimentary back then compared to how things work now. And that has a lot to do with things like interoperability as well, and access to patient records and shared care records and all of this kind of thing. So you start to pull the thread, and actually there's
you realise
whole...
it's a lot more complicated in the NHS than it would be for gov.uk in a way, because even though it's a government is very complex, the workflow for that car tax example isn't all that mind-bendingly difficult to understand. I mean, you have to have a registry that knows whether your car has insurance, and you have to have a registry that knows whether it's registered to you, and then you have some kind of bank transfer or payment system. If you bring those threads together, everyone can use that same portal because they all have the same journey. Whereas I think in the NHS, there are so many thousands and thousands of different types of journey that we're talking about, whether it's a trip to the podiatrist or it's redeeming a quite complex secondary care prescription that you can't get from your GP. Or there are thousands and thousands of different things we want to do. It's going to take a long time and a lot of hard work to get all of those improved to the point where they're a similar level of digital maturity kind of thing. I feel as though good time to bring in the golden phrase of all this, which is doing the hard work to make it simple. And that was the great phrase that they coined at the start of the GDS team. And all their blogs are still up online from the very first one. And they're quite good reading, just to explain how they broke down the barriers of government. And they did a great job. And they set the scene in a way for us to do some of the stuff that's been done. For example, like in nhs.uk, that's a success story in that what was NHS Choices and was a very complicated series of fairly labyrinthine web pages with small text and long words, and they converted all that using specialist content authors who would bring it down to understandable words, thinking about the average reading age of the country and making sure that people would be able to understand it. What we haven't got to yet, we're struggling with the next bit, which is making the transactions work. So we can go to nhs.uk and you can read about your condition, but where are the buttons at the bottom that say, do this, do that, do that, get referred to a dermatologist, and we're not really in a position to do some of those things because partly to do with the organisation of the NHS. For example, if there was a button that said that a web page could refer you to a dermatologist, there would be concerns that would be abused, and the dermatologists would get lots and lots of low quality referrals because we're used to everything going through a GP. But given the fact that GPs are actually the rate limiting step at the moment and no one can get to see their GP to get referred on to the next thing, maybe we need to look at better pathways that allow you, perhaps with some preconditions or some patient education that has to happen first. And then when you've done that, you can then be referred to not necessarily a consultant dermatologist, but in my example, the next stage of care, bypassing the GP, because all the GP is going to say is, okay, well, I agree. You probably do need to see a consultant dermatologist or a specialist nurse or something. We used to see a lot of that with ophthalmology referrals. And I think that's actually been addressed now. But for years and years, you would see an optometrist in the high street and they would say, having looked in your eyes and with all their expertise and all their specialist machinery, they would look in your eyes and say, you need to see a consultant ophthalmologist to have somebody look at the back of your eye in more detail and have some treatment for it. And then they would send a letter to your GP. And I, as a GP, would then be in the position of referring you to an ophthalmologist. I'm not going to say no to that referral because obviously if somebody with the expertise of a high street optometrist with their equipment and their expertise thinks you need to see, I'm not in a position to decline that. So why does it need to come through me at all? It should go direct. And I think actually that has been changed. That does happen now. But there are lots and lots of other areas where that perhaps can be clinically improved.
I think so. And I think a lot of improvement and development hinges on interoperability and access to electronic health records and in the right way so that the right people can see the right things at the right time, and make sure that everything is above board and adhering to information governance and everybody's done their DPIA, etc., etc. But true interoperability as well. So not like, here's a PDF you can attach, but I've done the thing, it's in the place. And we see, there are some referral softwares out there which are making that process a whole lot easier. But that hinges on a procurement, which hinges on funding, which hinges on this and that, and frameworks being released or not. And that's a huge transformation piece that needs to happen. And a lot of it can be addressed with, well, if we did it in-house, then we could take care of all of it. But that's not the way it is currently. So, okay, how do we improve the things that are there currently? And is there space to innovate before we take the plunge of doing it all ourselves? Are we ever going to, there's lots of improvements that can be made that ask a lot of questions, but in essence, I think a lot of things would be a lot easier if we just cracked the interoperable nut and figured all of that out once and for all, which will we? I'd like to think that we will one day.
I think one day. It sounds like that's an important sort of upstream requirement, and there's quite a few actually of these kind of infrastructural deficits that we're not addressing yet. And when we address those, suddenly the things that we can do will become transformative. But at the moment, they're not available to us because we haven't done the hard work to make it simple. The hard work is the interoperability, and that means later on you could receive care at 3 different centres and they would all see the same set of notes. But we're not in a position to deliver that yet. So it feels like perhaps that's a future episode, is what are the precursors or the prerequisites to really important changes in digital delivery of the NHS.
Completely. And it can go from, who has access to a shared care record, what data is going into that shared care record, the development of a shared care record. Like, there's all kinds of different things that feed into that conversation. Even things like the access, things like, we can talk about, NHS Connect and NHS accounts and the NHS tenant and how that's enabling some things but blocking other things and all the rest of it. Like, you start to talk about one thing and actually it's about so many other things. Like, digital is just everything all at once, and it's very difficult just to hone in and say, right, we're going to fix this single thing. And that's where I think transformation, like, it would be wonderful to transform all of these things, but it's either going to take a whole lot of time and money and resource, or we kind of change tack and make those little developments and improvements where we can with what we've got, with a view that we shouldn't ignore the bigger problems altogether. But I can't fix the big problems by myself. I can't, we've all got strategies in our organizations and priorities and budgets and disasters happening left, right, and center. So it's kind of a very, like, let's think locally rather than globally approach, which isn't necessarily the best and only way that we should do things, but it's definitely a way that if you aren't a massive decision maker and you can't push back on certain things, at least you can say, right, okay, well, let's go and find out what we can do with what we've got and make an improvement rather than a transformation, because that's still a win. Just because you haven't transformed everything and fixed all of the big problems doesn't mean that it isn't a win. It's definitely still a win.
And there's so much scope there to go at it, kind of thing. I like the idea of having a system as well that can be shared. So if you decided to do an improvement, how you would break down the stages of that improvement, kind of thing. And the government digital service team had a system like that, and they called it the service manual. And by creating some regularity and some reproducibility, they could then disseminate that way of working to multiple teams. And so you can imagine something like that working in the NHS, where we've got, this is how to do the improvement without stipulating that it has to be a digital solution, or without stipulating that it has to be a procurement or any of those kind of things. Having quite open-ended but still structured, what you might call a playbook for improvement, that then all the local teams can carry on can take away and use. So in a way, that gives you the best of both things. You've got some degree of national coordination, but you let the local areas still have enough autonomy to do it their own way, but using the framework. So you don't just get chaos of everybody doing a different thing. You say, these are the ways to do it. And where possible, these are the points where you can harmonize with each other so that all your systems will work together. I mean, it's clear there's a huge amount to talk about in this area, but I feel as though we've got started there with some.
Yeah, definitely part one
of digital transformation. This is the episode I wanted to call "Digital Transformation is a Dangerous Lie." I've been convinced to change the title and make it a little softer and gentler, which I think is probably a good idea. But yeah, I think there's definitely bits we can come back to, and there are areas that we can go further and discuss. So, where are those toolkits? There are things that are emerging, things like the NHS prototype kit and the NHS front-end UI kit.
There's loads of evidence-based implementation frameworks.
Yeah.
We could talk more about that.
Yeah.
I mean, people want to know.
That
we'll talk about it.
The future is already here. It's just not evenly distributed. That's Carl Sagan.
Nice.
And that's exactly what it is. Some areas of the NHS are doing great things, but we maybe need to be better at socializing that stuff. And maybe that's one thing we can do on here. Anyway, thanks for watching. Hopefully this channel is turning into something that you would like to watch and find useful. We're very happy to cover topics that you suggest. So if you do comment of things that you would like to hear us discuss, if you would like to see particular guests on the show, then we will do that. It's something I'd like to do to make sure that there's a really good accessible resource for digital health everywhere. So yeah, topic suggestions. If you've got views about digital transformation, then definitely let us know what they are in the comments.
I'd love to have a follow-up episode where we get a lot of
I
really want to hear what other people think, where we might have gotten things wrong or not quite right in particular. Like, what's your definition of digital transformation? Do you agree that we should maybe think of it more in terms of clinical development and improvement, or X development and improvement, so it's not just clinical but other things as well? I'm keen to see what people are thinking and the talking points around that.
Absolutely. Well, thank you very much, and we'll see you in the next one.